Okay, let's start with Department of Human Services. It was requested that because the interpreter has to leave by a certain time, we're gonna start with HMS 202 and then take questions on 202 before going on to the rest of the department. So go ahead, Director.
Sure, thank you. For HMS 202, we didn't have a budget request, but we do have a CIP for Hawai'i. And Division of Vocational Rehabilitation is here if you want to have Maureen Bates, the administrator of that program, cover that budget request for DVR.
That's for,
202 doesn't have a CIP.
I don't see the CIP request.
That's for DVR, which is 802. But-
I'm looking at table 15. I don't see it.
So some of the program IDs on the hearing notice are not, they don't have budget requests. So what I was going to request that we do is go by program. So for example, DVR, BESD, Medquest, so that we don't have to jump around.
No, that's fine, but I think you just said there was a CIP request for 202. I don't see it.
Not for 202, for 802,
Well, I
voc
don't see
rehab.
802 either, so.
Okay, does anybody have questions about HMS 202? It's the first on the agenda.
Vocational rehab.
Do you have anything you want to share about that?
We do have CIP requests that will be in that are pending before Governor Green right now. So I think I'm thinking of that, but for age blind and disabled, we don't have a budget request. So what I'd like to do is go by program, if that's possible.
Yeah, so
Chair.
just go by the agenda, and if you say there's nothing, just skip it.
Okay, so that means that the administrators, if I could have one administrator come up for each one. So
Yeah,
for
so
example,
202, so start with 202 then.
okay, 202, there's no budget request.
Okay, next.
General assistance payments, 204, no budget request. Federal assistant payments, 211, no budget request. Let's see, do we have one for cash support for family self-sufficiency, HMS 211, no budget request. Rental housing services, HMS 220. They do have a budget request, so rental housing services, is that 220, is that BESD or HPHA?
Good afternoon, chairs, vice chairs, members of the committee. Hakeem Wansafi, executive director for the Hawai'i Public Housing Authority. And outside, I have a bunch of branch chiefs in case if you have specific questions I'm not able to answer. Going directly to the respect of the time, table 3, page 79. HMS 220 and also HMS 222, we are requesting increases in the federal fund ceiling for each of the program ID. This is needed because of the anticipated grant awards for Section 8 program and the federal public housing programs. And then table 4, page 84, HMS 222, we are requesting $500,000 for the state rental supplement program. This is to maintain the existing folks that we are serving, but also potentially adding 70 more families as we have opened the wait list. Table 15, page 142, HMS 220. The previous Governor Ige has authorized CIP lump sum of $10 million, a fund for both FY24 and FY25. So these are the requests you have in front of you in the testimony. I'm here to answer any questions that you have.
Any questions?
Just in the rent supplement, how many will you serve in terms of the increase that you're asking for?
We currently serve 198, and for this $500,000 will potentially serve an additional 70.
So
The average subsidy is $435 per month.
So do you have a waiting? I know we've asked before whether you have a waiting list or not. Have you ever kept a waiting list to know what the needs are out there? Because you prevent them from becoming homeless, so that's why.
Yeah, so we only open the list if we have funding because it gives kind of false hope to have.
So you don't have a waiting list?
No, I do
You
not
don't
have a
keep
waiting
track of
list.
it.
Do you have?
We
do you
could.
keep track of inquiries?
We do. Currently, we
How
have
many
just
do you have?
4,000. I'm sorry, 2,000.
2,000,
2,000 inquiries.
3,000, in your, how many? 2,000, you're
2,000.
serving 700 in the amount that you're getting.
So we have 2,000 inquiries, which means 2,000 families are interested in this rent supplement program, but we do not have the funding for it.
So the funding provides for, you said, what, 700 families,
The funding currently 198 families.
198 families?
198 families. An average rent supplement is $435 per month per family. The majority of them are elderly and disabled.
When you take the inquiries, do you have any information that you take down in terms of need that they will be homeless if they're not, or you just take the names down and that you just
Yeah.
know the numbers?
Thank you. I think all those are representing to us that they are at risk of homelessness, that they come out short each month, at least that amount.
So is there a way that you can assess what their needs are? Is it $500, $400, $100, or you don't ask those questions when they call in for the inquiries?
From the previous runs that we have done when we opened the wait list, because the maximum was $500, we only qualified up to that number of 500. If we increase, let's say through administrative rules or anything else, if we increase the amount to more, I'm sure we will have other folks that are qualifying for that. But I do not have the exact number.
But this amount prevents those
for sure.
198 from becoming homeless?
That's correct.
So you give everybody 500 no matter what.
We look at how much they're short and we give them up to 500.
Okay. So
There
some
are
people
some
might
that get $230. There are some that get the maximum of 500.
Because it seems that this is a better way than having them go on the street. And you know, how can we look at how we can serve more people then under this program? Because it's a good program to stave off getting homeless.
We believe this is the smallest program we're running, but we believe it's one of the best programs that we have because it's truly those who either work in or have limited income, but they just come out short each month. We scaled this back before. I think we served up to about 500 individuals, but as the funding was reduced, we only kept serving according to what we have. But it is an excellent program. And
So can you give us an estimate? I mean, maybe we have to increase while we have funds so that we can keep them off the streets.
happy to send it to the committee.
Some kind of
Absolutely.
plan
Sure.
going forward. Thank
Yes,
you.
I can.
Thank you, Chair.
She's going to cut out of Department of Labor and
Yeah, sure, because they're going to be working.
That's okay with us.
But what development projects do you have in the pipe?
Thank you. So School Street, 250 units, shoveling ground August of this year. That's phase one. That's with the money that you have given us in the past. An application for KPT phase one, 304 units. We have finished the EIS and the 201H application that was approved. That's for next year. And our board just approved today to go out for an RFQ for 10,000 units, encompassing a variety of different properties that we have along the rail and in every single island.
Okay, if you can maybe send us a breakdown of that and with a timeline.
I can, absolutely.
You'll cover the neighbor islands as well, right?
100%.
Okay.
100%.
But when he gives us the breakdown, we
Yeah.
can share it.
Yes, 100%. The RFQ has all the islands for sure.
Yeah, because that might be the better approach instead of consistent.
Yeah, if you have enough.
Yeah, any other questions?
You guys Section 8. How you guys enforcement for Section 8? And then when you guys do the inspection, I know you guys get criteria because I just get concerned about Iroquois Point. They've been opening it up to now Section 8 since when shut down the beach rentals. Anyway, so they went up to Section 8. What is the criteria of right now is still having problems with their drinking water? And why would Section 8 even contemplating putting people that is on Section 8 in a community like that having drinking water issues that they gotta buy bottled water and water to shower and drink on a daily basis?
Yeah, no, thank you. So with regards to Section 8, we follow the federal law, it's a federal program. It is the tenant or the prospective tenant that has the right to look for a housing anywhere they deem appropriate. What we do is, once we get that, is making sure that it's past all the safety features. So if he doesn't have water, it will not pass. We will not issue the Section 8 voucher. If he has any health or safety issues, if it's something that can be fixed, we give an opportunity to the landlord to fix it. If not, we refuse to accept that unit. And ultimately, once that's done, the landlord enter into an agreement with the tenant, and we enter into the portion that the federal government pays on that behalf. So if they don't have water, they don't have hot water, or they don't have good drinking water, as an example, it will not pass the inspection.
And then for abusing of Section 8, so like say right now I'm a Section 8 person, and I decide that I'm gonna sublease them to Senator De La Cruz. Rent my bedrooms out, and then I'm gonna sleep in a parlor, rent the rest of the house to Senator De La Cruz, because we know hard time for finding housing. Who enforces that?
If we find you doing that, we'll send you to jail. And it's as simple as that. We're very careful on this, because you're absolutely right. There are so many people that try to take advantage. We do yearly inspection. They have to bring us all of the information, who's occupying it, and any violation is subject to removal of the Section 8 voucher. If it's a gross violation like this, that's considered illegal. We'll take a legal action by informing HUD, if they want to inform the Inspector General to do investigation. And we had cases like that. And those folks will be obligated to return all of the monies that they have tried to defraud the government. But we do have in place, if we got a complaint, for example, we will follow up on it. And that's how we do it.
Would they send it to you guys? Who do you have to?
Yeah, they come to us.
Okay.
Come to us. Just keep in mind that if it's in the county of Honolulu,
Yeah.
it's either us or the city and county. We both administer Section 8 voucher. And if it's in the neighbor islands, it's the counties that we do not, we only manage on Oahu.
Okay, take your chair.
Thank you.
Any other questions? Okay, next.
All right, thanks, Chair.
Thank you.
I didn't get to, although you all know me, I didn't get to properly do an introduction. Kathy Bedsford, Department of Human Services, and Deputy Joseph Campos. Thanks for this opportunity to provide testimony on our budget request. Moving on to HMS 224, that is BESD.
Good afternoon, chairs and members. Skamori Shige, Division Administrator of the Benefits, Employment and Support Services Division. Presenting our budget request for HMS 224 Homeless Services. So we have 5 items. I'll go over the 4 items related to homeless service, existing homeless services, then cover the 5th item, which is to establish and maintain a homeless services database. So for the 4 items, to provide general funding for existing homeless services that were previously funded over the past biennium by V funds, American Rescue Plan Act funds. The first item is for family assessment centers, requesting 1.55 million for 2 family assessment centers, one on Oahu and one in Puna on Hawaii Island. Family assessment centers are low barrier emergency shelters for families with minor children. And again, these are existing services that have been in place for the past several years. The second item is for a state housing first program. We have a housing first program on Oahu, as well as in the other 3 main counties. We're requesting 3.75 million for fiscal year 24 and 25, again in A funds. The third item is for rapid rehousing. This is short to medium term supports plus rental subsidy for homeless individuals or individuals at risk of homelessness. We're requesting 3.75 million per year for each year of the biennium. And the 4th item is for outreach and civil legal services to provide direct connection to people who are living unsheltered, and to also offer civil legal services for individuals who need assistance with identification and other vital documents. This is again 1.75 million for each year of the biennium. And then the 5th item under HMS 224 is a request for 345,000 on a recurring basis, again in A funds, to establish and maintain a homeless services database. This is part of our overall approach to increase our access to quality data, so we're able to provide analysis and use the data to inform future program and policy making. And I'm available to answer any questions if you have any. Thank you.
Questions? Senator Pavella.
It's good to hear, the only thing I wanted to ask, I'm sorry. I wanted to ask is that, you know, when you guys homeless database, how, cooperative is the county and all these other 600 million guys to get grants and money to take care of homeless, but we get homeless on the streets to yet? How cooperative are them? Because I hear the city does it once a year, and I will tell you why. So we had a cleanup scheduled for Tuesday at my park where the homeless is using our tennis court for a clothesline. But because they're gonna count the homeless, they said they're gonna postpone everything to the 25th. How is that fair to the community? Steve, you like know how much homeless get in the community? Ask the guy who worked with them. Why you gonna reinvent the wheel? You know why they don't ask us? But the fiscal agents that go out there comes once a year. And then they don't come back anymore. After they get their grants and they get their money and they're all comfortable because they got their budget. So how accurate that we can do to help you guys collect this data and so that we can have an actual count of these guys who get in the grants and get in the monies every year and not fulfilling their end of the bargain. And how I know that? You go to the west side, they're all over the street sleeping. So I want to know how we can help you guys in collecting the data and if they are cooperative with you guys and giving you guys this information.
No, thank you, Senator, for the question. So I want to clarify the way that we currently collect data regarding homeless services is we partner with our 2 continuum of care in the state. We have 1 continuum of care on Oahu, Partners in Care, and 1 for the neighbor islands called Bridging the Gap. And what those organizations do is they're basically the coalitions of homeless service providers within their communities, and they also manage federal funding for homelessness. So we currently partner with them, and each of them maintain their own database, and we do a data pool on a regular basis into a 3rd database that we maintain. What we're trying to do now is explore options of whether we can enhance the existing systems for our partners so that they're better able to collect better quality data and more accurate data like what you're requesting, or whether it makes more sense for us to enhance our system so that we're able to better aggregate and do the same. We put this request in as a placeholder to make sure that we've had a place for the budget request, and we're continuing ongoing discussion with both COCs to figure out what's the best path that will get us the best quality information.
Just one follow-up. So since the Linda Lino administration, how they had Hope for New Beginning in my community, which is great, we love it. Need some help here and there, but before back in the day, a community leader or a person that's working with the homeless the longest in the community would be able to say, hey, Senator is on my community more than often. I think he needs some help. So back then I could write one letter, one voucher letter, they call it voucher now, write one letter, take Senator De La Cruz with me, take it to Hope for New Beginning, and they'll start the process. They cannot intake him immediately, but they'll start the process. Now they gotta go through a fiscal agent that would put out all the information, spit it to an agency to wait for them to give a reply. By the time that happens, Senator De La Cruz did 6 different areas, six different communities. So those are the things that we can work on to expedite the services and the intake for our houseless community to get in these programs.
No, thank you, Senator. And our homeless programs office and HMS 224 will work closely with the governor's coordinator on homelessness in HMS 777 so that we can better coordinate services and ensure a more seamless access to care. But thank you for all the information.
Just one follow-up. I'm not gonna say the representative's name. I work closely with that person. He called you guys' department and someone from the governor, and somebody told him that you guys not start yet because you guys are not in the department. So I'm gonna try to follow up with that because that person was very upset. He talked to the governor about it, that he had called to talk about our homeless situation. And he said that they wasn't taking calls because they don't start to January 4th or something like that. So I just letting you know, the person is new and they was excited to try to help their community. Just kind of check into that because we need the help, all the help we can get.
Thanks, Senator. And I wanted to clarify the distinction between HMS 224, which is the Homeless Programs Office, which oversees contracts for existing homeless services, and HMS 777, which is the newly established statewide office on housing and homeless solutions. I understand this is a little bit confusing because that's my former position. But we do have a new governor's coordinator, James Koshiba, sitting behind me, who's in that role, and his office and our homeless programs office will be coordinating to, again, make sure that we can ensure good access to care and that we're getting good quality data about the homeless services we're providing. So thank you.
Yeah, thank you, Chair.
Thank you.
Chair, I have a follow-up question since we have Scott here. That homeless has been a real big problem for us, and thank you when you were the coordinator, and James Koshiba, thank you. But looking at your data and talking about information technology systems and being able to have a clearinghouse, I see that your fiscal year 2021 in the variant performance measures and program revenues, it increases from 5,900 to 2024, going to 6,900. So if we're putting money into these services, shouldn't the numbers be reducing over time? And how did you get those figures? And how will we get those figures so it's more accurate? And in
Senator-
terms of the money that we put in, that we see some results that actually people are getting off the streets.
Thank you, Senator. Just for my clarity, what table or page number are you referring to in our testimony? So I can.
This is in your report on performance measures in your testimony under the variance report. Your measures of effectiveness. It is,
Or is it in the appendix 1?
yeah, the variance report. It's report P62. I have it as page 1058, but I don't know what that's.
I think it's 401
Oh,
in the variance report.
Well, no, I think it's a different thing than this. It's
It's HMS 224 program ID. That's what we have
to
report.
clarify, are you asking about the variance report or?
Yeah, it's
the
the program
appendix
target
1?
groups, and then you have measures of effectiveness. Under measures of effectiveness, it says number of people experience homelessness statewide, and it gives figures.
Senator, are you referring to the variance reports that are
Sorry,
for
sorry.
Oh, okay.
PNF?
Yeah.
Oh, okay,
yeah.
sorry,
So
sorry, it's
I-
under the.
I understand what you're referencing. So I believe that the numbers show an increase over time because of the potential impacts of inflation and looking at historic trends over time when it comes to homeless data. So those numbers, I think, are based off of the homeless point in time count numbers. And what we anticipate is when you look back historically between 2009 and 2016, there was an increase in the number of people experiencing homelessness as our community came out of the last major recession. So knowing what the impacts are of the pandemic on the economy and the potential increases in inflation, I think those numbers are based off of projections that our homeless count may increase, although we're continuing to focus on services.
So
So
just
try and
in
just be
terms of going
pragmatic.
forward, as we're talking about having the some kind of better information system, that it could be more accurate than just sort of point in time information. And I hope you're working with both the providers of that information, the partners in care, and then bridging the gap people so that we get more accurate data.
Yes, thanks, Senator. I think the need for accurate data is sort of the genesis for this request. As I mentioned, we're having ongoing dialogue with both COCs and the department.
Thank you. I'm going to switch gears if I still can on the remote work question.
Yeah, go ahead.
Okay. So thank you. I want to go back to your budget on your remote work. And that is table, what is the table?
Is there an HMS
Yeah.
ID,
Yeah,
Senator?
it's
that
an
we can
addition,
refer
the
to?
request for all your telework.
for, is that 904?
Okay,
Table six,
table 6,
additions.
these, what is it? Okay. Remote work.
Okay. Separate,
Yeah.
oh, the remote work, okay.
That's a
Yes,
separate,
we have lots of
request.
reports and lots of
Yeah.
divisions, so thank you for clarifying.
so you have a number of telework, remote work requests or people out. And your reason for them being out is able to fully perform work duties with hybrid work schedule is indefinite. Have you been following a policy in terms of telework and looking at how they can be more accountable in terms of productivity and the work they do if they are working off-site?
Sure, Senator, we were following the interim DHERD policy regarding telework. Many of our staff have experienced increased productivity. As you know, across the country, endemic to human services professionals, we are experiencing retention issues and recruitment issues based on the fact that a lot of our staff experience people in crisis and trauma. They bring home vicarious trauma and their work with them home. What we have found for our teleworkers and remote workers, and mind you, I think on some of the charts, it says some of them are 100% teleworking. That just may reflect that they are teleworking 1 to 2 days a week. It doesn't mean they are teleworking 5 days a week. However, what we have experienced is increased productivity. As you recall, in 2020, when we had to ramp up our application processes, our online systems, we invested heavily in technology and the capacity for our workers to have all tools at their fingertips so that they could be productive and efficient workers.
Yeah, how do you measure productivity?
How do we measure it? All of our division heads are in constant communication with their staff. They have constant communication. They
Yeah,
have
but
daily
that's not a
huddles.
measurement.
I mean, I could have our division heads come up and specifically relay what they do in order to determine accountability, but we were the first for Medicaid, for example, we're the first in the nation to allow access to Medicaid benefits and implement access to benefits for residents from compact nations, first in the nation. For our BESD folks, we were the first in Region 9 to implement the PEBT program, which afforded millions of dollars in nutritious meals to children during the pandemic. That is ongoing. Our child care programs office, who are here today.
But you have all kinds, not just those. You have HR people, you have auditors. I mean, people who are not just dealing with the specific clients.
And so, yeah, how do your HR people stay off site if
You have
they're
over
supposed to be
700
helping?
people.
We do have many folks remote working. What we have found from my view, where I sit, I see my folks.
That's not the question, though. You have to come up with a metrics of productivity
Sure,
that's measurable that you can show us to
Sure.
see that.
we from the Medquest division, even though a good chunk of workers remote work, they've been able to have no backlog in applications, even though their cases doubled since 2020. So right now, I believe it's 467,000 individuals that had access to timely and efficient benefits for health coverage. I think that's a pretty good predictor that our folks are working. They also monitor their
But
telephone
there's others,
calls.
there's policy and program specialists, there's
Different
directors,
divisions.
planners, enterprise officer. I mean, it's not just, you gotta come up with some metrics.
Sure, I can get more data to you, Chair.
Well, I
Going
think
over 20.
The question really is that there's a new policy that's been negotiated with HGA. So when that's implemented, are you gonna continue the telework that you have right now? Or are you gonna call everybody back and then implement?
I think it's specific to each division and the type of work that they operate. I mean, obviously for HPHA, there were 0 teleworkers. For social services division, child welfare, adult protective, very few teleworkers. For folks that we have invested in the technology and we've seen that they've been efficient, we are able to do that on
Okay,
a
but I know when you
case-by-case
say
basis.
generally they've been efficient. So I think what some of the people here are trying to look at is tell us what that means as far as efficiency, meaning X number of cases processed, more people signed up, and you're timely and certain on doing things. The HR one is the one that's a little is an issue for us because every department has a backlog on filling. And if the HR person is teleworking, and how is that really fitting in? I mean, we have a department, for example, that said that there were no openings on their website. And we find out that the HR person was teleworking.
I can see your point, Vice Chair. As I was mentioning to Chair Dela Cruz, from where I sit,
Yeah, but
and I
I
do
get the
monitor my
anecdotal,
staff.
I do get the anecdotal, but there's no specific or statistical data that shows it.
We can pull that data from each division, Chair. It's difficult because our workforce is so diverse. We have up to 2,300 positions that are,
Sure, but
Right.
when you implement the work, the telework policy, I mean, the supervision is by, I guess, the supervisors and then division heads. And they all should have some criteria why they're allowing the telework. And they all should be able to judge that. So as far as gathering the data, I mean, that should have started from when the teleworking was allowed. So all we're asking for is give us the status of the situation now. I'm kind of looking forward to hearing the good news.
sure. I understand that you want, objective
Yeah.
quantitative data. I would say, though, that from the
Office
be-
assistant,
from the beginning.
You-
From the beginning of the pandemic, we are not post-pandemic. This department has never been post-pandemic. We still have people out due to COVID. We've had deaths from COVID. From my
no,
perspective.
I understand. We're just asking for the data that shows productivity, measurements of productivity.
Sure,
You've got 667 people working telework as from your table. So, and they run the gamut of public information officer to human resource specialists. And they're not all intake people or people who are doing inspections. So again, the productivity question is, how do you determine, how does supervisor determine that these are high performing people that can stay at home and do, like you say, not, do more because they're not fighting traffic or whatever, but
Sure.
there should be a rationale behind it and not just everybody because, they're able to fully perform it.
sure. I understand that. I
That's
think
that's a
there-
concern.
Okay, thanks, Senator. I think that there is rationale from our leadership's perspective. Obviously, safety was the first thing that we needed to consider in terms of our rationale from a leadership perspective as soon as the pandemic started. However, we do have performance appraisals for every single one of our employees. For new probation hires, they have to pass probation within the first 6 months, so that is monitored. And I think some of the division heads, as they come up and go over their budget requests, they can probably respond to some of the more specific data that they collect from their staff to ensure efficiency and productivity.
I follow up.
Senator Kim.
So are they required to come in certain amount of days or they can stay out 5 days?
The majority are coming in at least 1 to 2 days in the office. However, that ranges across divisions. Some divisions have, a lot of teleworkers and a lot of people working from home, and some of them do not. So it really depends on how much public facing, for example, child welfare, if they need to make home visits and do
Yeah,
investigations.
but they did that
Yeah.
even when they were in the office.
Correct.
Shouldn't there be some consistent policy? Because we hear from workers that feel that, they're not being treated equally.
That's an interesting comment from our employees. I feel like what we've tried to do is treat them on a case-by-case basis, depending on the
But
work that
It
they can do.
allows for special treatment. It allows for disparities between different departments, but not being treated the same. So you need to have some consistent policy across the board. And then if there's special circumstances, then that be taken up. But to have it just, each department, it just depends. I mean, that's no way to run a department.
Senator, I understand your concerns. I completely understand. However, I do think that, for example, Department of Human Services, it's a very different department than every other
Yeah,
department.
but her question
So-
was, are they at least required to come into the office at some point? Because you got quite a bit of people with 5 days.
Yes, so it depends on the
The whole
division,
week, that means they're gone.
correct, but
So what happens to their office space?
they've,
They gave it up.
no, they haven't given up their office space.
But
per
if they
se.
didn't come in at all, then why do they have the office space?
We've been reallocating space for folks that are still in office.
Because we have people leasing, and so that's where we have to reconcile what this new policy is gonna be, how we're gonna show measurements of accountability. And the idea was these group desks or shared desks or,
Share spaces, yeah,
but
correct.
to have that many people not come to the office at all.
I mean, everybody can make a reasonable case for working at home. And then I've read some of this, and maybe not yours, but because we can't have adequate distancing in the office. I mean, it's like, everybody can make that argument, and then why we even have the department and why even have space if that's the case?
Understand your concern, Senator. I do, for example, director's office, we do still allow teleworking. It is so that we aren't in cramped cubicles right next to each other. I have employees with elderly parents that they're caregivers for, and I want to be able to retain that staff.
Can you say that again? You have
I
employees,
have employees with elderly parents that they're caregivers for.
but you're not supposed to do caregiving. while
They're
you're
not,
on-
they aren't caregiving, but if they are going to be commuting for 2 hours a day, I'd rather have them be able to be home at 5 o'clock to do caregiving for their parents. I also don't want, I couldn't forgive myself if someone was in my office and contracted it and brought it home to a family member with an impaired condition or,
But that's the case for everybody. I mean, that's why.
Absolutely.
That's why each division has to make sure that you're masking, that you put up some dividers, because we've gone and done visits to departments, they're not wearing a mask. They don't have separation. I mean, and then they're saying, oh, we're afraid. I mean, it's like, if you're not employing these kinds of practices, then yeah, you should be concerned. But if you are, I mean, you can't help if somebody gets the flu and take it home, right?
that's correct.
I mean,
But
so, I mean, that was the case forever before COVID.
correct.
So, I mean, it's like, okay, now is the excuse why, if everybody's gonna stay at home, then we need to make special arrangements for your office space and their office space, and then, but there needs to be a consistent policy. So can you submit your policy
Sure,
to us?
sure.
Thank you.
Sure.
I just got one more follow-up question on this, on the space, because on what you're saying, is that these people are staying home at 5 days a week, then you really need to look at the reconfiguration of the office and looking at how you can look at space and the use of space more wisely. So if in fact you're cramped in your office, you shouldn't be cramped in your office, that you really should be looking at what is the space allocation for the people you do need, and you need them in the office. So if these people are staying home 5 days a week, they're not needed in the office, then you really should be looking at the appropriate space allocation accordingly.
Yeah,
So
I
we
agree,
can
Senator.
really look at that.
And I think that, as I mentioned before, I think that when our division administrators come up, if they could relay
We're
a
gonna
little
be
bit
here
about
all
what their
night.
policy is.
Yeah.
What's
No,
that?
so you can just send it to us.
Okay, sure,
But we need to see measurements of productivity,
sure. We can do that. Thank you.
and let's say there is, it ends up being justified. So if when it ends up being justified and they are out 5 days a week, then it's that second component of, okay, do we need that space? Because we got a lot of agencies that are saying they need more space.
Sure.
Can we get when we look at the policy for remote working from the state policy that should apply to all the departments, whether or not travel time is a reason that they should be allowed to
Yeah,
work?
we can have the
Because,
deeper.
to say that if they're on the road for 2 hours, and I don't know if that's part of that reason.
Senator, that's a really good point. I wouldn't argue that it's part of a rationale for telework. I would argue that it's a rationale for retention for human services professionals. They have very difficult work. We've had, as I mentioned, and Chair, you've heard our stories, you've met with our child welfare workers. They have very difficult jobs. It's really difficult to retain and recruit human services professionals across the continent right now. So every human service agency is dealing with this issue right now.
No, I mean, that's the same thing for attorneys. That's the same thing for attorneys, but
Prison guards. I mean,
But you're not suggesting that you can deviate from the telework policy that's been negotiated.
No, absolutely not. We adhere to the policy.
the problem is the policy right now that when you look, it doesn't have any measurements for productivity. So once that's established, okay, I think that we at least have that.
Sure. absolutely. This is Jennifer Muraoka from our
We don't
HR
have to
office.
extend the,
She just wanted to share some
okay, you can,
information.
Hi, sorry, I'm acting right now. As you know, Brenna Hashimoto was our DHRO and now she's the director of DHERD. But they are implementing a new telework guidelines and policy, and Brenna actually created our own DHS teleworking guidelines and policy.
Oh, she
And
didn't tell us that.
We actually are the gatekeepers at HR as far as what kind of classifications of work can telework and cannot, and what kind of technology allows them to do so. So in general, many of the folks that are like eligibility workers or social workers that actually have productivity on computers, they can telework as well as HR assistants, HR specialists. A lot of them can telework from home as well because we have computers. So majority of our HR specialists are not doing recruitment. The recruitment folks telework 1 day a week at most, but only the specialists. And then the other folks are doing classification and compensation, which we can all do on the computer and by telephone. Labor relations, all by telephone and computer as well. So we're trying to just extend the fact that our director is in full support of teleworking and that fairness.
just go back to what are the
Yes.
measurements of productivity and how do you report that? How do you show that? How do you
Yes.
account for that?
Yes, so every division administrator and
See,
supervisor.
that's where
is
I think
accountable.
Senator Kim is saying there has to be some consistency in
Yes,
that.
and that is on the performance appraisal system. There are expectations on there that you write it down and you explain that to every single employee. And we hold every single employee to that. And we ensure that if they're not doing that, then they come to our HR office and talk to our labor relations section. And then we implement plans to make sure, and we make them return to work. We've made a bunch of folks return to work to monitor them physically, because that's not necessarily how we always want to monitor them as well, right? Physically, there's a lot of folks that can still be, not producing while they're still physically in the office. So it's actually better for us to monitor them by their computer and productivity at work. How often are they having meetings? How often are they completing their assignments? How often are they doing their specialist work and creating jobs and classifications? How often are they responding to phone calls? All of those are metrics that we're
Yeah, so
utilizing.
just share that with us.
Yes, yes.
And then if you can share some specific examples of how you've actually measured some of those teleworking.
Yes, we can.
So you can send it to us.
Yes.
Thank you. Thank you.
Yeah, I mean, we've had some departments say no parking. So that's the reason for telework.
Oh, I'm sorry. Actually, it was just shared with us that the original teleworking guidelines that were created in 2010 was actually to ease traffic congestion. So, traffic is actually on the new teleworking guidelines as far as, there's a lot of folks that we have a lot of applicants now that we need to go from Waianae coming to downtown and we don't offer parking, so not only parking, but traffic congestion. So, if that will be a retention tool and a recruitment tool that we can utilize so that they can eventually, after they pass their initial or new probationary period, telework 1 to 2 days and not have to be in traffic for 1 to 2 hours. Hey.
Yeah, but there's also the flexibility schedule. So you could just start late and late
They
and
could.
avoid traffic.
They could do
And that-
alternative work week schedule. Yes, but I think a lot of workers and a lot of young people nowadays would like the option to telework and not be in the office every single day.
Everybody would like to stay at home. and do their
Absolutely.
Laundry and do everything else while they're working.
Well, we
So-
need to measure that.
Yes. so
And
I'm
we
just
are here.
saying
Yes,
that
no, I
it's not
understand
just
that.
certain people.
Absolutely.
So that's the argument that we have to.
I don't know if
accept.
young people are doing laundry, but
No, and I'm not saying they shouldn't be
Yeah.
doing it, but I'm saying that everybody would like to do that.
no,
Take
absolutely.
care of their pets.
Absolutely.
whatever.
Of course. They want to be home with their pet,
Right.
but
They don't
now
wanna
in this,
drive in traffic. I don't
Right.
want to drive in.
in
traffic.
this time, we're just really trying to hold on to them and retain and recruit good employees.
Well, some departments have said that they're pulling everybody back on February 1st, but you don't intend to do that.
No.
Good.
Okay.
Okay, then real quick, let's go to the variance report for HMS 301. Program activity. Children receiving family strengthening services. So you had planned for 2,499 and you only did 2,057. So you didn't meet your performance metrics.
That's for social services division. So if I could
Okay,
have Daisy,
that's just tied into telework.
pardon?
That's tied into the telework discussion. So you're not necessarily meeting a lot of what you had.
Sorry, I'm Chair. Could I have Daisy Hartsfield come to respond to that? She's Social Services Division Administrator because 301 is
Sure. Bring her up, bring
SSD.
her up.
Okay,
but
then
Chair-
you take HMS 302.
I mean, all of them, I mean, you have
302 is
people from
busy.
every division that's on telework and
So
so the
it-
question really applies to all of them.
yeah, if you just look at the variance reports, not every goal is being met.
Again.
That's,
So that's where you gotta start to reconcile these things, because I hear what you're saying, but the reports don't exactly tell the same story that you're telling us.
okay, sure. We can take a look at the variance reports and come up with an explanation.
Well, it's an explanation.
Sorry, I was waiting a long time, and it's nothing to you guys, but the bottom line is, I listening, and I wish you guys all go back and watch this retelecast. Because it's insane to be telling us that these guys are teleworking because we might lose them as a worker. If that's the case, then we're not gonna have no state workers. It shouldn't be a way of retaining somebody, because when you get up in the morning, being an adult and responsibility is we go to work. And regardless of the traffic, not having lunch, no matter how difficult your job is, or how stressful your job is, you took the job. Because if that's the case, all the teachers don't like teach certain divisions, they're gonna stay home. You gotta watch this, because I'm sitting here and watching the guys, whoever came up over here, try to justify to my colleagues why you guys tell them, and then they ask you, all the divisions are bringing everybody back to evaluate, and then you guys' answer is no. Then you guys said you guys meeting your requirements. Senator Cruz says you guys not meeting your requirements. Then you want to have somebody to come and justify it. Please watch this video. 'Cause I'm pretty sure people out there that watching this is thinking it's crazy. Because if you're not going to get into human resources or human services, then don't apply for the job. It shouldn't be, because we're going to give you telework. That should be the retentions of why you're working in this department. That is crazy. That is crazy. I'm sorry, man. I'm sitting here listening to this. This is crazy.
So
I
if,
cannot handle that. Sorry, Chair.
so if you just look at the variance reports, you look at program target group, DHS licensed childcare providers. You had planned for 990, you had less than, you didn't meet that goal, you were at 820. Number of licensed providers investigated for health safety violations. You planned for 45, only 13 were done. Number of childcare slots available due to licensing, 35,000, but you're only able to do 31,000, 4,000 there. So,
Sure,
I mean, I can go variance report after
Sure.
variance report where you're not meeting the expectations,
sure.
but
And
you're
each,
just, you're here justifying telework to us saying that you are.
well, I think that each explanation is going to vary across HMSID for childcare. Obviously, we had providers drop out of childcare completely because of the pandemic. Trying to license folks, it's difficult during a pandemic. So a lot of our childcare providers have decided it's too risky to be childcare providers, even with retention bonuses, even with our childcare programs office disseminating $162 million to them over the last 2 years.
Okay.
So.
But
those
there's,
are
I mean,
issues that-
okay, it's not just that, but I mean, we have HMS 303. Children receiving on-call shelter care, the goal was 350, you only did half of that.
Shelter
I mean-
care, sure, sure.
But we still should. We're stuck on 224. Yeah, because we're just gonna go in circles on this telework and your variance report. So you're gonna try to justify it. You hear our concern, you gotta try to address it. Yeah.
Which was 227 if there's needs.
Aloha Chair, Vice Chairs, members of the committee. I'm Daisy Hartsfield. I'm the administrator for the Social Services Division. For HMS 301, we currently have 3 budget requests that are included in the governor's decisions. Two of them are housekeeping matters. One of them is to align salaries of newly created Family First Hawaii positions that was approved by the legislature last session. What we need to do is to align the salaries so that it matches the classifications per the contracted agreement with the union. The second housekeeping matter is to align the number of positions currently in our child welfare services. And the most significant request we have in regards to 301 has to do with the appropriation from the Spouse and Children Abuse Special Fund. Last session, there was two parts that we had submitted. One had to do with increasing the amount that could be held in the account. That was passed last session. However, the appropriation to increase the amount to 5 billion so that we could access that funding was not approved. And so we're back again asking for that appropriation so that we can access federal reimbursement so that we plan on depositing into that account so that we can draw on that money and repurpose it to use to pay for prevention services.
Okay,
So
so I'm sorry. I remember passing that bill. I mean, you
Yes.
tried it a couple of times and my understanding was you just wanted the increase in the ceiling. And now you're saying that we need to have funding, not just an increased ceiling?
no, we don't, we need an appropriation so that we can access the 5 million, because the current appropriation is at $1 million, a little over $1
You
million.
guys didn't ask that last time, though. You guys just wanted to have the increased ceiling on the child, I mean, that special fund.
We included it in the budget, but it was not approved. So we got the statute amended to raise the amount.
The ceiling, yeah.
Yeah, but in the appropriation was not increased.
Okay, so you didn't tell me it was tied. Because I remember we tried a couple of times back when I was in the House and then in the Senate, we finally passed it.
We were under the impression that it was going to get passed. That's what we were told. And then at the last
Okay.
minute, it was not. So we're asking for that again. I also am with HMS 303, 601, 605, and 901, but we don't have any budget requests that were included in the governor's
What
decision at
numbers?
this point in time.
Try the numbers again. You just want to.
Sure, 303, 601, 605, and 901. And just a brief response as to teleworking. We're one of the. few-
Actually, no. We
Oh,
have
okay.
other-
Yeah,
Others
we
who are gonna be coming up.
We're going to just go in circles.
Okay,
Yeah.
yes.
So. So Director, when you say you have no requests, that's in the steady state budget. But do you have some on appeal? Because if you do have some on appeal. And you want to mention them, I think you might as well, as long as you're here, but you can go ahead.
But you're not sure what's approved.
Correct.
But do you have a bill? You guys-
For the requests that are not in the.
We do have some notes that they're supplementing for administration.
Okay, you should work that out with subject matter chair though.
I have working.
Okay.
I'm gonna be trying to go over some of
The priorities that she believes are important then.
Correct.
So, I had a question on 601 though.
Okay, sure.
I mean, this is sad to see that the number of adults reported to be abused is higher.
Yeah, and actually, we were anticipating that because during the pandemic, we believe that there are less visible eyes on our vulnerable adults. And as the pandemic eased, more adults were being seen by the community. And so we were anticipating getting more reports. And that's part of our request for additional positions for nursing positions as well as 2 intake positions in the adult branch.
Okay. But you don't have any vacancies in that branch.
I'm happy to say that that branch does not have a vacancy issue.
Okay.
Any other
No, you
questions?
can go next one.
Okay, thank you.
And to Jeanette.
305.
You appropriated 45 new positions from 248 that she brought away in 2022. And there was an overpayment, so that was just adjusting the overpayment for those 20 positions that were going to for childcare support. For, let's see, 303, no budget requests, 305, no budget requests, 01, no further unit, that's our Medquest position. And then we invite director of PDN position up to the.
Hello, good afternoon. I'm Judah Moore-Peterson, Medquest Administrator. We just have 3 requests that were included that I wanted to highlight. One was the request for ongoing funding for the child wellness pilot, incentive pilot. This is something that Senator Buenaventura, sorry about that, initiated and got passed last legislative session. It was for the financing was only for 1 year, and this is a request to continue it. So the pilot is for 5 years. The other request that I wanted to call out was for nursing facilities, and this is to increase payments to nursing facilities so that they can be up to cost. We're using this as an opportunity because we have to come up with we have to redo the methodology because CMS is changing the methodology. So we have to change the methodology. And so we're using this as an opportunity to also rebase the rates at the same time. And then the third item that was included related to professional fees. Included in Governor Ige's request was a request for $5 million and then $10 million, which would bring up professional fees up to about 75% of Medicare. And then Governor Green is intended on increasing that up so that the total amount would be 30 million for both fiscal years. With it's about $43 million of federal funds that would be needed. Something that was not included in the initial request, but is still up for consideration, is allocating or creating ceilings for the sustainability funds, which would be B funds, which would be for both the nursing facility program as well as the hospital sustainability program. We're seeking through a bill working with Healthcare Association of Hawaii to have those both be permanent programs instead of coming back every 2 years and having them reauthorized. And this is the budget action that would be needed to have those programs be permanent. That's what I wanted to call out for you today.
So the nursing facility increase, is that the bill to increase it to Medicare payment reimbursement, the Medicaid, to increase the reimbursement to the nursing facilities from the current Medicaid payment reimbursement to a higher Medicare? Is that?
The Medicare doesn't have the equivalent for nursing facilities because the Medicare doesn't pay for long-term care. Like,
okay,
we pay for long-term care. So it's not that's not the bill. This one is just for nursing facilities. We have to change the methodology. And you may recall that there was the pandemic payments
yes,
from last
5%.
Mhm.
So is that
It's to sort of continue on that help to the nursing facilities
and
to
then-
bring them up to cost.
Okay, is it only nursing facilities or does that include adult care and foster homes?
This particular budget request is only for nursing facilities. As you are aware, we conducted a home and community-based studies rate study in which and we provided you the information that if we wanted to increase the rates for home community-based
The adult care
providers
foster homes.
of how much adult foster homes or for adult residential care homes, in-home services, we provided you that information. Should any of you be interested?
Okay, I don't remember that information, but yeah, can provide it again.
Okay, well, I mean, I
So-
have a little bit today if you wanted it, or otherwise we can.
Email it to me.
Okay.
Okay.
So do you have a plan or some idea of what you would recommend as a budget increase? Because it's so low that we do need to increase, especially as the federal CMS is moving us out of institutions and into community care, that
Yeah, I
if you
did,
can provide us with what your recommendations might be as we look at the budget.
yeah, we already provided that to your office. We're happy to do that again.
So if you can have,
It's in,
if we can have
I guess you're gonna
information,
cut that out of labor and DHER.
well, I think it's needed
Yeah,
though,
so you just
because
find the
they have
rate
done
cut.
a study.
That's fine. Because the 1 billion, I mean, I think everybody spent the 2.6 already.
Wow.
So there's no more money. I mean, DOE is asking for 451 people.
Well, we got to take care of our
You know,
old people.
The hospitals are asking for additional 153 million.
53 million.
Yes, but this is keeping them out of the
Sharon.
hospitals.
Well,
You gotta-
it's not only that, there's not too many people can do this
If you're
job.
looking at increasing taxes the way you're
Right.
spending.
But I think we have to take care of the people who are in need. That's our job.
That's fine. So you just gotta find the cuts that you think there's waste.
Well, I think if we have a plan going forward and we can see how much, then we can look at it over time.
again, we'll provide the information as part of the legislative report.
If you
that
can
we
do it more
provided.
formally.
It's is it Senate Resolution 4?
Yeah.
Yes,
Okay,
sorry.
next.
Yeah.
Hi, good afternoon, Chair, Vice Chair, members of the committee, Leanne Gillespie, Executive Director for the Office of Services. We have several CIP and operational requests for 501, 503 for governor's decision. For 503, CIP requests, we're asking for 1.550 million for the sewer system. Our property at HYCF is antiquated and has is actually in drastic need of fixes. We're also asking for 4.9 million to upgrade the water system improvements. HMS
Is
501,
that for construction?
yes.
So you're ready to go this year?
No, not ready to go this year. I do have Mark Patterson here from HYCF.
No, I'm
and
just curious,
answer questions.
because you've got in the first year of the biennium, so.
So I think this for mostly for planning purposes. And
That's where my
assessment.
office will contact him to
Okay,
get a breakout.
he can certainly give you the details on that request.
So how many at Kauai Loa?
How many youth?
Yeah,
Quilo, we serve approximately, there's 70 beds on the Quilo campus. We serve probably in addition to that, another 150 youth a day in our day programs, Quilo.
so all 70 beds are used.
It depends on the days and. But yeah, yes, generally they are full.
Okay,
Justice involved that are there for administration.
Yeah.
We have a
Oh,
30-bed facility that
right.
houses 15 currently incarcerated youth.
okay.
The rest I might do.
20-bed facility for homeless shelter, which is full.
That's what
We have about an 8-bed facility for minors homeless that's about half full right now, and we have a vocational residential program housing young adults, about 8 beds. Oh, I'm sorry, we have 8 beds for assessment center for victims of
Yeah,
sex
but
trafficking.
you're mixing it up with the-
How come if there's a need that it's only half full? What is the, for, you said you have the number of beds, but it's only half full?
So Kauai
That-
Loa is-
That means you have empty beds? that are-
Oh, that's the current, and when talking about the 30 beds, the juvenile justice reform has had lowered the incarcerated rate. So that's currently where we are right now at about 1 girl and 14 boys. Yeah, if you look at the detention center, they're running single digits daily. And they have zeroed out themselves on certain days as well. So that's in a looking at the system as a whole, incarceration is down, the jail population is down, probation is down, petitions are down.
But arrests are up,
We haven't seen anything in the up.
juvenile arrests.
Yes. I have the
Because we
last
see-
judicial report.
Because we have, we funded more alternative learning centers in DOE
Yeah.
to address juvenile arrests, and DOE's, we're trying to establish more ALCs throughout the state because trying to see what we can do to meet the challenges of that population. So there
We have-
seems to be
Sometimes you can have the
contradicting data
arrest, but
between
it doesn't mean
DOE
it
and-
went to court. It might not be adjudicated, so I
I
can
mean,
only
the number of
attest for the ones.
suspensions,
Yeah. I'm not privy to DOE information. So,
but same population.
Yes.
I'm just saying that
yes.
I don't think it's as rosy as you're making it sound.
No, the system has looked at the alternatives, ways of dealing with the kids rather than the punitive model that we have. been.
Except you guys, so the youth services centers, that was established when?
2018,
For 2018.
No, I thought it was 1991, the
that was
creation
the
of it.
statute.
Yeah,
Yes.
Yes. the
So it
creation of
took
the
you-
statute.
from 1991 to 2018 to finally establish it.
It was unfunded.
Did you ever ask for funds though?
Yes.
I don't know what the history of that was.
Okay. And then we had asked for you guys to create a statewide plan
For safe spaces, yes,
over the interim.
yes. We're working on the Safe Spaces, Act 130.
Yeah, so what happened?
So we have, the plan is fluid. We've currently, issued a contract for the Hawaii Youth Services Network to implement the National Safe Place program as a component of Safe Spaces. We have, increased 4 of our DHS contracts.
When are you gonna provide that to us in writing though?
We can do that.
Yeah, I don't know if telework is all that it's meant to be, because that was something that we passed last session. We wanted for interim and we need a plan.
I can provide you with a plan.
Another question? Okay,
HMS 601, no budget request, HMS 605, no budget request. HMS 777, that's the newly created Office on Homelessness and Housing Solutions, James Koshiba, who is the newly appointed executive director.
Aloha Chair, Vice
Aloha.
Chair, committee members. James Koshiba, I'm the new Governor's Coordinator on Homelessness, and you're correct, Senator Favela. I wasn't able to start work until January 3rd, so I'm about 2.5 weeks in. I did speak to your colleague, I believe the one you're referring to, so I might check back in with him. I thought we had a productive conversation. I'm here to speak to 2 requests within HMS 777. One is the budget request from my office, that's 777 HH01, Office of Homelessness and Housing Solutions. I won't go over the whole mandate, but I guess the pieces I would highlight are, to develop plans to ensure coordination, not only between state agencies, but between the state and counties and private entities as well. And then to test innovative solutions to prevent and end homelessness, and adopt strategies to address system gaps and developing and implementing strategies to fill those gaps. And the reason I want to highlight those is because my background actually is the last 7 years spent in street outreach, weekly to multiple communities across Oahu, including spending a good amount of time with Pu'uhonua o Waianae at the Waianae Boat Harbor. And I believe one of the things I can bring to the task is a street perspective. Unsheltered homelessness is probably the most pressing issue. It's the portion of the homeless population that has continued to increase over the last 10 years. And so I bring some of that perspective, and then having worked on some different non-traditional solutions to homelessness, including Pu'uhonua o Waianae's permanent housing in Waianae Valley, I can bring some of that experience and perspectives to the table. I will say at the outset, before I get into the actual budget requests, that being 2.5 weeks in, I'm still getting up to speed on many of the tools and in the toolbox of the state. And so I will answer whatever questions I can about the specific programs today, and what I can't answer, I'm happy to get back to you.
Okay,
on.
so your ask is only of the what, 5 positions and 500,000.
The 5 positions, 500,000 for my office. And then the second item is for Ohana zones, and that's HMS 777 HHBF. And that's $15 million per year over the next 2 years. That continues the funding.
That was in the EA administration too.
Yeah, that was. Mhm.
I don't see it on table 6. So table 6, your page 23, I see 777, the 5 and the 500,000.
Is that
Then it
the
goes straight to
224?
904.
I think that's because it was it a different program ID?
The HMS 777 was just newly created.
Okay, so where's the other one?
The Ohana zone funds will be transferred from HMS 904 to HMS 777. 904 is general
904. Oh, so it's the one.
admin for director's office.
Subject 224, is it? Where is it under now? The Ohana zone.
Why does it only? Oh, page 88. Oh, next page. Oh, okay, I see it. It's not together. Why is it out of order? 15. No need.
So,
No need.
okay.
By the transition team.
Yeah.
Got it. Okay. Okay.
Okay, questions for James?
Sure. We have the influx of homelessness in our state, and I brought this up before previously. How can we control, or how the state, county, federal, doesn't matter. Back in the day when we had the walk-in talk detail at the airport, we stopped not only drugs, because people still bring drugs on, but mainly our houseless population that would come from another state. Back then you never need ID, but now they're bringing fake ID. And we still have the influx of homelessness coming from mainland states to our community. How are we going to be able to get our people off the streets when we are housing other states homeless people?
Yeah, I took a look at the most recent data. So the 2022 report on the Bridging the Gap point in time count data, that's for neighbor islands, and the point in time count data for Oahu. And it's actually a relatively small percentage of folks that are recent and newcomers to Hawaii that make up, the portion of Hawaii's population. On Hawaii Island, where they had a specific question about, are you a recent arrival? It was just under 10% of the entire population. On Oahu, I don't believe we asked that question anymore on the point in time count survey. The last time it was asked was, I believe, 2017. And at that time, about 70% of people on the street had been in Hawaii for 5 years or more.
Glad you're going down Waianae and taking care of family down there. But do me a favor, go to North Shore by Foodland where the fire station is. Just go sit there at 5:30 and you'll see our visitors from the mainland that don't go back home
Yeah.
in that area. Thank you, Chair.
Okay, next.
Thank you.
Oh, do you have a
But
question?
I just have a question on the Ohana zones. You keep on describing it as a pilot program. Do we have evaluation, a performance evaluation of its effectiveness, and it is recurring for the next 2 years, but I'm just wondering how we can assess it and see whether it should be not a pilot anymore.
Mhm. I believe there was an assessment conducted last year. I can send you that report.
So
Um,
so we can recommend, should it be a pilot or should it be permanent? Because it's really being able to make a difference in our
Sure,
community. So
sure. And I can tell you that, the way it's being used by the counties and in the counties is really as a critical source of gap funding for projects and services that help people get permanently housed, but that projects and programs that don't fit into existing funding boxes. So one good example is tiny home villages like Kama'oku, right, are not eligible for HUD funding. because one of the rules that comes attached to HUD federal funding is every unit must have its own bathroom. And so that model of village style housing makes a lot of sense for Hawaii actually, and is a low cost way to both build and operate. But because it doesn't qualify for federal funds, this pot of funds is essentially testing those
So
models
just
out.
to clarify in that report or assessment is what things HUD funds, or we have federal funding for, and this really is something the state needs to step up
Yeah.
to make sure that we do have
Mhm.
unsheltered people sheltered.
Mhm.
So is the proposal to include this as a new line item for your department then?
For
Marco,
Ohana Zone funding,
is this being part of your base
Oh,
budget?
yeah,
then?
that's what they're
we are
asking.
requesting that it be placed in the base budget. We would like to continue it, not as a pilot, but as a permanent source of funding to
How much of the
eradicate
15
homelessness.
is going towards programs that are not funded by the federal government?
Let's see, it's in our ledge report that we provided to the
Oh,
legislature.
if it's in there, then no.
Okay, I can provide that number though. Unless you know it.
I know.
Thank you.
Thank you.
Okay, moving on. Okay,
Okay, so, excuse me, so originally the Ohana Zones pilot project was supposed to be 25 million one time to create these, Kahalas type of thing. And it hasn't happened, right? Basically, you guys are using it to fund like RISE, and that's why you guys wanted to put it in to the base, but
So I thought it's also a grant program for the counties, right?
correct,
Yeah.
correct. It goes
is
directly to
also-
the
yeah,
counties.
no,
that
no,
in contract.
That's little, because the Kauhale we actually funded in the budget. This was a grant program to counties and they established these Ohana zones.
Exactly.
okay, no, but I guess what I'm trying to say is, why does it need to be a 15 million every year or every 2 years kind of thing when you're actually building the infrastructure? Shouldn't it decrease over time? I mean, that's the reason why it was a pilot project to begin with, instead of,
Yeah, I don't think that it would necessarily decrease over time. You know, I think part of it is related to what Scott mentioned earlier. There are headwinds that are actually creating a lot of pressure on the system and increasing the number of homeless folks on the street. So, you know, number one is the housing costs continue to rise. Number two is inflation, which is putting pressure on all of our households. And number three is the lasting effects of the pandemic, and not just financial, but on mental health and physical health. And so we're starting to see on the street, you know, I've been out talking to providers the last several weeks, and they're starting to see the increase, and they're starting to see an increase, as I think, you know, all of our kind of anecdotal experience would affirm that there's a larger need in terms of mental health and behavioral health services. And so those needs are increasing. And the projects that are being funded through this and through the counties are both permanent supportive housing and providing those services for
so
folks
there's
once
some
they're housed.
duplication with Department of Health.
I'm sorry.
Never mind. We'll just-
And she was saying there may be duplication between this and Department of Health programs.
Yeah, I'm not sure. I can find out. But my sense is from talking to the counties, you know, and talking to them about the projects that they're funding with Ohana Zone funding, this was not funding that they could have gotten from any other source.
Yes,
we were-
but do you know why the counties don't want to fund it on themselves?
My understanding is that most of the funding that counties have available to address homelessness are federal funds from.
No,
HUD.
but you know, we gave them the additional 3% on the TAT.
Mhm.
Property values are rising. They're flush with cash.
Yeah.
So
I can
I'm not
ask-
sure, maybe what we should be doing this is turning this into a matching program.
Yeah, especially since Department of Health is asking for some monies for the behavioral health issues.
Mhm.
So you are coordinating with the counties
Especially
and
the rate
also with
Senator
the,
Moriwaki spends, which this should be probably a matching program.
so it just coordinating with the counties and coordinating with other departments like Department of Health so that there isn't that kind of duplication and we can make our funding
Mhm.
go further in
Yeah.
terms of supporting the homeless who have mental health and substance abuse problems, but also getting them into more a better place in terms of housing or assisted housing.
Mhm. Yeah, I think the matching and cost sharing is definitely something worth exploring. And I guess the last thing I would share is just that, you know, I tried to take a look at the per capita spending on homelessness by state. And it's hard to get apples to apples comparisons, but depending on the source you're looking at, we're somewhere around the middle of states or in the bottom third for spending per capita on homelessness.
Just based on HMS's budget?
No, this is the total combined spending, the federal, state and county. Yeah.
Because it's not just this. I mean, we provide homeless services in
Yeah.
DOE.
Yeah,
in
that's why it's hard to
Department
do
of
the apples to apples, right?
And we give out GIAs.
Mhm.
Property ordinance.
I mean,
Yeah. Mhm.
it's kind of self-defeating to see that we just keep spending more and more money. And the problem doesn't seem to be really.
Yeah, and I can share more about the strategy, you know, the priorities.
Well, maybe before the substantive committee. You can do
Yeah,
that.
yeah.
Mhm.
Or in individual meetings with senators, happy to do that too.
Yeah, sorry, we just have DHHL waiting outside too. And so we're
Sure.
probably gonna be here till about 8 o'clock.
We're wrapping up, Chair. Vocational rehabilitation. Senator. HMS 802 is Division of Vocational Rehabilitation. That'll be brief. Our Administrator Maureen Bates is here to cover that budget request.
Thank you. Committee members, my name is Maureen Bates.
Speaking for the mic, please.
Thank you, Chair and committee members. My name is Maureen Bates. I'm the administrator for the Division of Vocational Rehabilitation. Our CIP request is designed for design and construction and focused on health and safety. And we're serving 1,000 consumers or more a year at this facility of Ho'opono for the service where we have our services for the blind branch. And our request is for 495,000. And it's broken out with enclosures of a air conditioning unit that serves the building and all of the spaces that we operate our training program and offer our services in. That air conditioning unit is exposed to the elements and we're looking to enclose that. Our other request is for paint the exteriors of the facility to prevent further degradation of the cement structure and also to protect the integrity of the facility. And the last part of the cost of the 495,000 are represented in retro commissioning of outdated fixtures that would save on energy and also ensure safety. So we're constantly fixing toilets and sinks, and this fixing is sort of band-aided and duct taped, and we would prefer to use adequate resources to make sure our participants or consumers are safe.
Okay.
So that's the
If you could submit that, because it's not on your table 15, so.
Did you want any information about the?
No, just send it to us, because I mean, it's just not on the table 15 as part of your testimony, but that'll be good. 495.
Okay, moving on to general support for self-sufficiency services, HMS 903. That's part of BESD. That's just trade-off funding for a defunded office assistant and TANF programs office. I'll quickly go over 904, Chair. We are requesting add-on funds for the family resource centers, which we're very grateful this legislature appropriated. We're requesting 605,000 to continue the family resource centers in our communities that most need them for fiscal year 24 and 25. 904-06 is add support $4,000 for the Commission on Fatherhood. As you know, we just our Commission on Fatherhood doesn't have a lot of funding, and it's difficult for them to do a lot of the community resources and things that they'd like to do without adequate funding. Finally, 904-01, that's just the housekeeping, delete positions and funds for the Office of Governor's Coordinator on Homelessness from 904, transfer it to 777, which James Koshiba covered earlier. And that is it for 904, and that's it for all of DHS.
Sorry. Just want to talk about the CWS workers. You know that the HB 2424 got vetoed. When you made the request for the monies for the additional, did the increase in social and funding that we tried to fund in HB 2424, is that included in your budget?
That's not included in governor's decision budget. It's coming before Governor Green. But in my discussions with Governor Green, he's, intimated his support for child welfare and
Could you
supporting
talk
workers.
into the mic, because I didn't quite hear that, I'm sorry.
It
So-
did not make it into the steady state budget from Governor Ige, but it is pending before Governor Green right now.
So it's not in the budget.
Not right now, as it is right now. It's pending before
So
Governor.
you're gonna make a request,
Correct.
a separate request for those additional monies. That also, so the family first monies, is that just simply the SCUSA funding? Or was that included in the budget regarding like the foster parent strengthening kind of things that we wanted to fund in the HB 2424?
What was funded in 2024 after the veto, we included in our budget request, which is currently being under review by Governor Green.
But it's not in this current budget.
Not in the current one because it was not included in the governor's decision by then Governor Ige.
Okay, so that's gonna be an additional ask. Okay. Good. Thank you. There's additional part included.
Recess, yeah.
No.
No. Senator Kim.
Thank you. I just wanted to ask, who is it then that work with the Micronesians on the Micronesian Compact?
The Compact of Freely Associated States is a federal appropriation
Right.
and a federal compact.
Under Medquest and
Correct.
does that
So
fall under?
our Medquest division, we receive the compact monies from the Department of Interior that goes mostly to DHS, but then a lot goes to DOE. On the federal level, there is a special envoy currently negotiating the
Okay.
extension of the compact, and our Medquest division through obviously our congressional delegation was able to allow access to compact residents to Medicaid coverage.
Well, we need help in the communities in which these families come and stay in private residence that apparently the government of Micronesia, I don't know if they purchase the homes or rent the homes, but they're causing a lot of problems in the community, noises, parking in people's driveways, all kinds of stuff. And they're reaching out and they don't know what to do, who to call regarding these issues other than the police. So can somebody help on this?
If it's private residences, it wouldn't necessarily be under our jurisdiction or our authority. But if there are social services needs that could be directed to us, then we would be happy to assist and reach out.
But if it's somebody that is responsible for giving these people the services, and even though they're in a private residence, I mean, shouldn't they have some kind of rules and, understand the laws, what they can and should not be doing? I mean, can we educate them or?
I believe there are educational services to help folks when they do come to the United States to assimilate, for lack of a better term. However,
Who does that fall under? It's
Office
not,
of Community Services used to have a immigration resource center for folks coming to the United States. And I believe that they are in the process of setting that back up. For us, we obviously offer all social services that are afforded to compact residents.
so can we have somebody from their contact my office?
Sure.
Thank you.
Got it. Second, to follow up on that. So I think what Senator Kim is referring to are there's these medical liaison homes where, people come here to go to Tripler or Shriners or some other hospital to get services. They're here for like 6 months and it's just constantly rotating. But it's under the auspices of a kind of a medical referral house. And does DHS license these entities? No? Okay. Maybe.
Should we maybe? Or should we have some?
I would assume that,
oversight?
Judy, do you know, at the Department of Health?
I asked the Department of Health, they said yes.
I'm sorry, I'm not aware of those homes. The most likely entity that would be licensing something like that would be with the Department of Health.
Okay.
And, Office of licensing, but I don't know what the situation is, yeah.
Appreciate that. Thank you.
Okay, adjourn.
Sorry.